So bone grafting is a procedure done for many different circumstances in oral surgery. This is done after dental extractions, but a lot of the time it's something that we utilize for patients who need implants who don't have enough bone. So bone grafting, in general, meaning means to add bone to areas where we need them, but it depends on the situation, the specific types, which we do here at Piedmont Implant Oral Surgery. So bone grafting, like most oral surgery procedures, can cause anxiety for the patient coming in and hearing about it and learning more about it. But my perspective is actually something very exciting. Many patients have been told that they are not candidates for implants, or that patients were recommended that they don't get implants. And really, my goal is to change that and to find ways that we can do bone grafting for you to get the teeth that maybe at that point you were convinced that you weren't able to get. A myth about bone grafting is that it is a very painful procedure. In fact, doing bone grafting, if you've done the right way, really should have minimal pain and swelling after the surgery. This can vary by situation to situation, but I think one misconception is that bone grafting causes a lot of postoperative discomfort. There are a variety of different kind of bone grafts and types of bone grafting procedures done for, in fact, many different areas of the mouth. So when I think about what type of bone graft and where it's coming from, it actually has to do with how much bone you have and how much bone we need to achieve with the bone grafting. Oftentimes, we will use bone from a manufacturer that is very sterile and safe to use. But in other instances, we will choose to harvest your own bone. And in those situations, it's a discussion about the pros and cons of both of those. But we're happy here to offer both for all the types of situations. For someone who has delayed implants or have delayed getting the consultation, I really would encourage them to come and seek consultation with us because you might find out that there might be, rather straightforward ways to achieve the bone grafting for you to get implants. So, I think it's all about a discussion and really personalized approach and treatment planning, which is what we do here. So I think that would be my advice is to get the information first and then to make sure you do it with someone who is going to take the time to give you all the pros and cons of grafting and how likely they're able to achieve implants for you. Recovery after bone grafting is in two phases. The first phase is the initial healing after the surgery, which takes about 4 to 5 days before patients start to feel almost back to normal. The longer side of the bone grafting, though, occurs after that initial phase when the bone is solidifying. That process takes anywhere from 3 to 5 months, depending on the type of bone grafting procedure that you had done.